So welcome back guys. In this particular communicable disease section, now I'm going to talk about the cholera, right? So if you talk about the cholera, so now we will be talking about the cholera, okay? So cholera is actually caused by which particular bacteria? Actually this is the bacteria which is causing the cholera, that is the Vibrio cholerae, right? So it is caused by Vibrio cholerae, okay? This thing you must have studied this in the microbiology as well, right? And Vibrio cholerae, right? Vibrio cholerae is having, very particular feature, right? As far as shape is concerned, right? It's kind of a different bacteria, right? So over here, we shall say that, it is the gram-negative bacteria, first of all, guys. It is a gram-negative bacteria, right? Having comma-shaped. Okay, so it is a comma-shaped bacteria, right? And with that I can say that it is having a flagella. So this is the flagellated bacteria, right? Flagellated bacteria, so it is a flagellated one, right? So over here you can see this particular image over here under the microscope, right? What I can see over here is that, for an example, look over here, right? Look at this one. It is having a comma shaped, it is having a particular comma shaped and having a flagella, right? Having a flagella like this. Look at this one, comma shaped and having a flagella like that, right? Comma shaped and having a flagella, right? So what is this particularly? This is your Vibrio cholerae under the microscope, right? So having this particular shape, okay, first thing. Second thing over here, that what is the reservoir, right? What is the reservoir in the cholera? Basically reservoir is the human only, right? Source, basically, if you talk about, right, either the cases are causing the clinical cases of the cholera are causing the cholera to the other people, right? Either the subclinical cases might cause the cholera to the other people, right? So either the carrier might be transmitting this particular disease to the other people, right, in the community. So basically cases or the carriers, right, they will be considered as source over here, right? What is the incubation period for the cholera? Incubation period is quite short as far as cholera is concerned. This is only about 1 to 2 days, right? As far as carriers are concerned, I told you that carriers might spread this disease, right? We are having two types of carriers, right? We are having the temporary carrier and the chronic carrier. Chronic carrier means, as the name suggests, chronic means if they are having the capacity to shed this microorganism for about more than 3 months, that is called as the carrier. That is called as, the chronic carrier, right? Otherwise we are having the temporary carrier also. So if we talk about the types of carrier, guys, if we talk about the types of carrier here, right, it might be having two types. One is the temporary carrier, right? Temporary carrier, they can't spread the disease, they can't shed the disease for a very long period of time, whereas chronic carrier is having that capacity that they might not be having the sign or symptoms, but they are having this capability to shed this Vibrio cholerae to the other people in the community, right? So that is about more than 3 months, right? We have talked about that in other diseases as well, right? Okay, as far as temporary carrier is concerned, guys, as far as temporary carrier is concerned, we are having some types over here, right? For an example, we are having incubatory carrier. Incubatory carrier means within period of 1 to 2 days, that is the incubation period, right? In that particular period, if they are shedding this particular Vibrio cholerae in the community, that is called as that they will be considered as the incubatory period carriers, right? Then we might be having the healthy carriers, right? They are particularly seems to be healthy, right? But they might spread the disease. Then we are having the convalescent carrier. Convalescent period is usually termed as that period where the people or where the patients have been recovered from the disease, where the patients are actually getting the recovery. In this particular recovery period, if they are actually spreading the microorganism, if they are spreading the disease in the community, right, that period will be called as the convalescent period, or those kind of carriers will be called as the convalescent carrier, basically, right? Okay, then we might be having the contact carrier as well, right? That with the contact and all, they might spread the disease, right? So these 4 kinds of carriers we should know in the temporary carrier category, right? What is the period of communicability if we talk about? So period of communicability, right? So period of communicability is quite long over here, if you talk about, it might spread from 8 days, okay, it might take from 8 days, it can go up to weeks, for some cases it can go up to months as well, right? So it's kind of a long long period of communicability you can see over there, right? So at this particular long period of time you can see the communicability in the particular population or community, right? Now here majority of the patients over here do not show signs and symptoms, so they are only having the mild category, right? They are not having very severe signs or symptoms, right? But a very few patients might be having the serious signs and symptoms as well, and the severe illness as well, right? So majority, if I'm saying majority, I mean around 70 to 80% population, on an average 75% of population I can say, right? They do not develop the disease in itself, right? They might be having the disease, but they are not showing the signs and symptoms in itself, right? So it is kind of a very mild category. But those patients, almost around 15 to 25% patients, okay, they might be having the severe illness as well, where they might be developing the severe dehydration, right? Why the dehydration component will come in over here? Because they will be having the very characteristic feature over here, that is the stools, rice water stools, okay? So they will be having a very severe diarrhea, and in that diarrhea, the particular color which you are seeing in the particular stools, that is the rice water stools, we are calling that as, right? Rice water stools, right? So very severe dehydration might be developing in those cases, right? So what I said is that majority of the cases, right, they do not develop the disease in itself, but those category who will be developing the disease, they will be having the severe diarrhea. They do not develop the disease in itself, right? Some cases, right, they might develop into the severe illness, right? They might be landing up into the serious trouble over there, right? They will be showing the signs and symptoms, and full-fledged disease will be going on over there, right? So some severe cases might develop severe dehydration because of that diarrhea component, right? We'll talk about the clinical features, guys, don't worry about that. Okay, fine. I'm just taking this picture over here, okay? I will talk about that in few minutes, right? Okay, one phenomena is seen usually, right? That what is this phenomena? Basically this is called as the epidemic tail phenomena. What does it says? Epidemic tail phenomena, usually cholera outbreak should not be seen in the community, but if it is seen in the community, okay, it's very commonly it's not seen because of the interventions from the government side, or you can say how well you are treating the disease, right? How well you are taking care of the community, right? So if in case the cholera outbreak is happening in some particular region, for an example, right, in some poor kind of area, if the cholera outbreak is happening, so how we can see the cases? Cholera outbreak is like suddenly the cases might be rising, right? Cases might be rising suddenly. But if you talk about the decline of that graph, right, decline will not be happening suddenly, decline will be gradually only. So what I'm saying is, this is called as the epidemic tail, right? This is called as epidemic tail phenomena. So what is epidemic tail phenomena? Epidemic tail phenomena, right? Epidemic tail phenomena means, it's very simple. If you will be seeing this particular graph, okay, what I'm saying is, suddenly the cases will be rising, but suddenly the cases will be rising, but when you talk about suddenly the cases will be rising, but when you will talk about the graph which is coming down, no, it's not coming down very easily, right? It is going like this, right? So it is actually sudden rise in the graph, sudden rise in the cholera cases, right? There is a cholera outbreak, and then graph is actually coming down gradually, right? And usually it takes very long period of time to come to the zero levels, okay? So it takes very long time. So that is called as the epidemic tail phenomena, and this particular tail I'm talking about over here, okay? This is called as tail. So epidemic tail phenomena, right? So tailing is actually happening very gradually, right? That is the epidemic tail phenomena. And here we might see that the cholera outbreak started, okay? So that is your epidemic tail phenomena, right? I hope you are clear about that. Now we shall move on to the clinical features of the cholera, right? Okay, so now we shall move on to the clinical features. Okay, guys. So what are the clinical features over here? In the clinical features, we might see, like any other disease, there might be the fever, right? There might be the fever. There might be, usually fever is not very prominent in the cholera, right? Fever is not very prominent in the cholera. basically. Okay, so over here what I can say, fever might be there, might not be there. With that, diarrhea is very prominent, right? Here we are talking about a very crucial term, rice water stools. Okay, there might be the nausea, there might be vomiting, right? There might be severe electrolyte imbalance because of diarrhea and the vomiting part, right? So that is the thing. Okay, and the stools frequency can be very severe in many of the cases, if the severe cases I'm talking about, right? And they might not come out from the washroom itself, right? So that is very severe kind of diarrhea we are talking about in this rice water stools, and severe electrolyte imbalance might be happening, right? We will talk about how to treat these kind of diseases, right? This kind of particular cholera, right? We'll talk about that. Just wait for some time, right? This is the thing. Because of this diarrhea and nausea, vomiting, okay, we will be seeing the electrolyte imbalance obviously and all, right? We will be actually seeing the dehydration in the patient obviously. Due to this dehydration, there would be sunken eyes. Okay, look at this particular patient. Okay, look at this particular patient. So look at this particular patient, guys, right? Here what we can see is that, you know, this patient is looking very dehydrated. This patient is looking very dehydrated. Here we are seeing, I'm talking about this thing. These are the sunken eyes of the patients, right? And here the patient is severely dehydrated because of nausea, vomiting, you know, diarrhea part, rice water stools will be seen over there, right? And this is the thing basically. Okay, how to clean the bed sheets and all for these kind of patients, we'll talk about that as well. Okay, so this is the sunken eyes which I was talking about. Severe dehydration you will be seeing in the cholera patients, right? How to make the diagnosis of such patients? Okay, if you talk about the diagnosis, right, then you might be doing the stool culture, right? You might be doing the stool culture, and mostly these cases must be diagnosed clinically. Mostly diagnosed clinically, right? Mostly diagnosed clinically. They should be diagnosed clinically, and with that, you know, you will be seeing the rice water stools appearance, and we will be telling you that thing, or you might do the stool culture. Okay, guys. How about the prevention part? How about the prevention part over here, right? Usually it is found where it is found. It is found basically in the developing countries, right? It might be found in, the African countries, may be found in, it is endemic in the, Indian continental region. Okay, so these are the regions where it could be found basically. So in these cases, you know, one thing is that, you know, if some traveler is planning to going to that particular country, right, they might be having the vaccine already. They might be having the vaccine. Which kind of vaccine? We are having the oral vaccines also. We will be talking about that in few moments, right? Okay, one option is that one. Otherwise, you know, we can actually immune our population, immune our community to this particular disease, right? Because we don't want to overburden our population with this particular disease, right? Okay, so we are having the vaccination part available with us right now these days, right? Okay, but before that, before coming to that part, okay, in the prevention part, okay, the sanitation is very important, right? We should make sure that, you know, the particular region, the particular community, okay, they will be having the proper toilet management over there. Proper excreta disposal should be taken place over here. The proper hygiene must be taken care in that particular region or the community over there, right? Disinfection should be happening time to time in this particular area or the region, right? We should make sure that there is proper food and water supply, right? There should be safe water and safe food supply, water supply. Okay, all of these things, sanitation is very important as far as cholera is concerned, right? It will be, so what will be our primary goal in the treatment itself or in the prevention part itself? Okay, what is the first goal which we need to keep in mind? That is the sanitation measures, right? If the hygiene part is very well, if the excretion of the feces and the fecal matter and all of these things are actually happening in the right manner, right? And if the food and water supply is actually safe and all of these things, right? So this will actually prevent this cholera in the community. Okay, so that is very important, right? So cholera, if in any case, in any region or in any community or in any population, if the cholera outbreak is happening, okay, if the epidemiologist is seeing that cholera outbreak is happening, they must be notifying it to the WHO, right? So cholera must be notified to the WHO, right? So cholera must be notified to WHO. To WHO. Okay, first point. Second point is over here that if the cholera patient is coming to us, right? we will be actually start them with oral rehydration solution, because we know that dehydration is actually seen very commonly in these patients. So dehydration is very, very important. So we'll be starting with the oral rehydration salts, right? ORS is very, very important. With that, we can actually give the zinc supplementation. Right? Zinc supplementation will help in absorption. Zinc supplementation is helping in absorption part of into the intestine, right? So that is very important, right? Okay, because malabsorption can be seen in these kind of patients. Okay, fine. Now, with that, after that, we shall start with the antibiotics. First of all, you should rehydrate the patient. When you will be starting the antibiotic, okay, directly patient is coming to you, okay, and you are giving antibiotic. It's not like that. First of all, you need to rehydrate your patient, right? You might be rehydrating it with the ORS and all if the patient is accepting the oral fluids, for an example, or in case if the patient is very, very severe, that either the patient is unconscious or either the patient is not not ready to take the oral fluid, right? In that case, you might take the help of the IV fluid. So first of all, you need to take care of rehydration part. Okay, so you need to treat the dehydration part first of all. So for that, you need to give the rehydration to the patient. Okay, either orally or either through the IV fluids, right? Once you'll be stabilizing your patient with the IV fluids, right? We are not giving the vasopressor over here. We are not giving the cardiotonic drugs over here, right? We are actually stabilizing our patient with the IV fluids only. If the patient is not taking the fluids orally, for example, right? We'll stabilize our patient with the IV fluids, and then after that we can think about the antibiotics treatment. Okay, obviously we need to give antibiotic because this is a Vibrio cholera we are treating over here, right? So obviously we need to give the antibiotics, but when to give antibiotic, that is also a question in itself. So we will be not starting the antibiotic at the first time. First of all, we need to take care of dehydration part. We will be giving the rehydration either through oral route, either through IV route, and then once the patient has been stabilized, as far as the rehydration part is concerned, right? So after 3 to 4 hours, we shall start with the antibiotics. So which antibiotic now we should be starting? That is also a question over here. So which antibiotic? So now we shall start the antibiotic, but antibiotic I told you when to start. First question is covered. So antibiotic when to start, guys? After the fluids, basically. Antibiotic after the fluids, basically, right? Depends on the patient to patient, oral fluid or IV fluid. Okay. With that, so fluid will take care of the rehydration therapy. Okay, so which kind of antibiotics we shall talk about over here? So two antibiotics I would like to mention over here. That is, one is the tetracycline, okay, and another one is the fluoroquinolones, right? So two antibiotics are very, very useful over here in these cases. One is the tetracycline you can use, and one is the fluoroquinolones group you can use over there, right? Now, in this case, as I told you earlier as well, that sanitation measures are very, very important. Okay, I would like to mention them, right, with this color. So, in the bold letter I'm mentioning the sanitation measures are very crucial in these cases, right? In the sanitation measures, what kind of things we are talking about? Basically, we are talking about safe food and water supply, right? Because usually it is happening with the contaminated food, what is the mode of transmission? Fecal-oral route. What is the mode of contamination? If I have not written over there, okay, please add it. Okay, so what is the mode of transmission over here, guys? Mode of transmission is the fecal-oral route only. So that's why I am emphasizing over here that safe water and food supply is very, very crucial in these cases. So fecal-oral route, isn't it? So that is the case. Now look over here, safe food and water supply. Second thing, the excretion of the human, basically excreta disposal should be taken care of. Okay, it should not be in the open spaces, right? Obviously. Then third thing over here, with the excreta disposal, okay, if the disinfection is happening, okay, disinfection should be happening in the right manner. Okay, so disinfection should be there first of all in the regions time to time. Okay, and if it is happening, it should be happening in a proper manner, right? Then the food hygiene part. Okay, food hygiene part should be there, right? With that, we shall talk about the, as I told you earlier as well, disinfection. We should be doing the disinfection over there, right, in a proper manner. Now, what is the disinfection? If I am saying what kind of disinfectant I can use over there, right? For an example, there is a patient, okay, in your particular ward, you are working in a hospital, right, and you are you are a duty doctor over there for an example, and if the cholera patient is there, right, we know that rice water stools will be there, okay, and if the bed sheet or the bed linen of this particular patient has been soiled with the stools, right, to clear that particular stools from the bed linen, okay, and obviously this particular bed sheet, okay, will be changed after that, but this particular bed sheet should be actually treated, right, it should be treated actually, and what you will be using over there, you will be using the coal tar disinfectant, okay. So which disinfectant we are using? That is the coal tar disinfectant, right, coal tar disinfectant. And the main thing over here in the coal tar disinfectant is that here we are talking about the Riedel-Walker coefficient, that is the RW coefficient. So RW coefficient of this particular case, that is the Riedel-Walker coefficient, okay. So the Riedel-Walker coefficient should be more than 10. Riedel-Walker coefficient should be more than 10, okay. This question has already been asked earlier. Riedel-Walker coefficient should be more than 10, guys, right, if you are using this coal tar disinfectant, okay. So that is actually telling us, you know, what do this Riedel-Walker coefficient or RW coefficient tells us? It tells us about the efficiency of the disinfectant which you are using, right. So efficiency of disinfectant is actually, you know, calculated by the basis of Riedel-Walker coefficient. It should be more than 10 if you are talking about the coal tar disinfectant in the treatment of the of this particular disinfectant you are using in the cholera, right, cholera for the cholera patient. As far as chemoprophylaxis is concerned, right, what drug we are using for the chemoprophylaxis purpose? We are using again, guys, tetracycline, or you might be using the doxycycline. So tetracycline might be used over there, right, that is also question, or doxycycline might be used, right. If you are using the doxycycline, you might be giving it 500 mg, right, twice a day in adults, right, or you might be giving the 125 mg BD if you are talking about the pediatric age group, that is the children, okay. This might be used accordingly, right. And now we shall move on to the vaccines part, right. Vaccines, in what cases we might take the vaccine? For example, for the travelers and all, they might be taking the vaccine. Make sure they will be taking the vaccine before 10 days of their traveling, before 10 days of their journey, right. For an example, if you are actually planning to going to the Africa, and let's say in the Africa the cholera is endemic these days, right, for an example, so in that particular case I need to take this vaccine particularly before 10 days of my journey, and then only I will be allowed, okay, fine. So that is the case over here. So one vaccine we are talking about, that is the Decoral basically, right, one vaccine, that is the Decoral, and the other vaccine which we are talking about, that is your Shanchol, okay, that is your Shanchol. So these are two vaccines. So for example, you can look over here, what I can see, you know, this is the Decoral vaccine, this is the oral vaccine, guys, this is the oral vaccine, oral inactivated cholera vaccine, okay. How many doses we are giving over here? We are giving the 2 doses, right, we are giving the 2 doses, right. So that is the thing, okay. And one dose is containing the 31.25 Vibrio Cholerae O1 strain, okay. You know, we are having the strains in the cholera category basically, and if you talk about the strains of cholera, okay, we are having two very popular strains over here, okay, strains of cholera. So one is the O139 and one is the O1 over here. For example, you are seeing that this is useful for the O1 strain, okay. So this is the O1 strain and this one is the O139 strain, okay. So two kinds of category we are using over here. Now let's talk about the vaccine in itself, right. Now let's talk about the difference between these two vaccines over itself, right. So we are having two vaccines, guys, we are having two vaccines. So one is the Decoral and on other side I am writing the Shanchol, right. So let's find out the differences, right, because it has been asked multiple times in the exams as well, okay. So this is important. So Decoral, guys, if you talk about, basically it is 50% efficacy, it is giving you the 50% efficacy in the particular patients, right. So both, if you talk about, either you can take the Decoral, either you are taking the Shanchol, it is giving the 50% effectivity. So they are 50% effective. So 50% effectivity is seen over there in both of these cases, right? On which strain you might be using it over here. So basically, if you talk about the decoral, it is actually working on the, it is working for the O1 strain of the cholera, right? And if you talk about the Sanacol, it might be working for the O1 as well as O139, right? And next point, that it is effective, it is effective for about 2 years after taking this vaccine. This is the oral vaccine, okay? Both of these are the oral vaccine only, right? And this one, if you are talking about it, it is actually effective for about 3 years, right? So it is effective for about 3 years, so somewhat better than decoral, right? I told you it is effective for O1 strain of Vibrio cholerae, and it is effective for both O1 and O139 strain as well, right? Here in the decoral, we might be taking the 2 doses over here, right? And in these 2 doses, you know, it should be taken at what particular time period should be there, right? In between the 2 doses, right? So that should be around 1 to 6 weeks. So 2 doses 1 to 6 weeks apart. Okay, that should be the time duration between these 2 doses, right? Over here also we are taking the 2 doses. Here the time between those 2 doses will be 2 weeks approximately, so 2 weeks apart, right? Next point over here is that, you know, in the adults and in the children, 2 parts are there, right? So in the adults, basically, if you are using this, okay, either you might use it for children. If you are using for adults, right, how to use it, and in the children how to use it. So what you will be doing, basically, you will be taking this particular vaccine, right, opening up the wrapper and all, you will be actually mixing it in 150 ml of water, right? So dissolve in 150 ml of water. It's very simple to take, okay, and drink it over 2 hours. Drink it over 2 hours. Okay, if you are giving for children, for an example, then you can dissolve in 75 ml of solution, 75 ml of water, right, and drink it over 2 hours, right? So very simple. So that's how we can actually get the prevention over here. Okay, how many days before the journey, that can also be asked. That is the 10 days before the journey one should be taking this particular doses, right? So that is about this particular, you know, comparison between the decoral and the Sanacol, right? So we have talked about the doses, we have talked about the effectivity, right? We have talked about the training also, right? And you know, these kind of decoral and Sanacol, right? In the infant, basically, right? In the infant, it should not be given. In fact, you know, if you talk about the decoral, it should not be given less than 2 years, and if you talk about the Sanacol, it should not be given less than 1 year. So let me mention about that as well. So it should not be given in less than 1 year of child, and here it should not to be given in less than 2 year of child. Okay, so that is the difference between the decoral and the Sanacol, right? Right, guys, so that was the difference between the decoral and the Sanacol. So this was about the cholera, right, where we have talked about the cause of the cholera, etiological agent, where we talked about the clinical features, we have talked about the prevention measures, right? Okay, so that was about the cholera.